Good afternoon, everyone, and welcome to our United Medical ACO live event. This is Friday, May 12th. We're going to be doing a little bit of a different presentation today, so we will not be doing our regular clinical updates, our community updates with Kamal. He is off today, traveling in Turkey. So I will be your hostess for today. Today we are doing our diabetes wellness webinar. So with us today, I have Dr. Hundal, who is an endocrinologist at First State Endocrinology. He is also our program director. With me, I also have Caroline Weber. She is one of our dietitians, and she runs our diabetes and nutrition program. And again, my name is Donna Gunkel. I am the Director of Clinical Integration and oversee all of the clinical programs and the wellness programs as well. So with that being said, I'm going to turn it over to you, Dr. Hundal, for you to start the presentation for today.
Thank you very much. And you're going to move the slides then?
I will, yes.
Okay, all right.
There we go. So actually, before we get started, I'll finish introducing the team. So I've talked about myself, Dr. Hundal, and Caroline. We also have two social workers who are part of our program, Roxana Portlock and Carla Williams, and they are with us from time to time to talk through some of the resources that we have in the community to assist our patients.
Donna, do you have the PowerPoint you can share with us?
Yes, I do. Sorry, I have it on my other screen, so I apologize. So yes, you can tell I don't usually run the program, but we'll go ahead and get started with that. So thank you, Caroline. So moving on to our first, here we go. This is our panelists for today, and we're going to be discussing traveling with diabetes. And Dr. Hundal, I will move to your first slide.
All right. Okay. All right. So being an endocrinologist, I frequently, like my patients ask me, okay, I'm traveling to this and this place and what I need to do. So we thought of like having a talk regarding this important topic. Even people with diabetes, they don't need to stop their lives. They need to enjoy their life, go around, enjoy as any other person, non-diabetic person does, but just with some take other precautions and they have to be careful about the medication, other things. So that's was the purpose of the talk today, is to how to prepare for a travel plan and how to do the best and avoid any major problems which can sort of create havoc on your travel thing. So again, safety comes first. So again, in general, we have highlighted some of these important points. I will elaborate on some of them where needed. So again, in general, don't wait until the last moment of the travel. Always plan ahead of time, pack your medications, important things way before, ahead of time. Don't start like few hours before or the day just before, because always when you do something in a hurry, you will mess up things. You will forget about important medications or something else. So always take precautions and say, okay, I'm going to pack 2-3 days in advance. So always keep the phone number of your physician handy. That's very important. Wherever you are, especially in the United States, your physicians will be available. Something emergency comes, you're not sure what to do, you can always call them. That's important. And to where you are planning to go and live for a few days in a hotel or somewhere else, always look around. You can Google search a local pharmacy, especially if it's a 24-hour pharmacy, that's even helpful. For some reason, if you miss some medication, forget to take them with you, or you need at the last moment, some people say, oh, I don't have any medication left, I need to be called over here, I left this medication at home. So have a pharmacy number available, because if you call your physician, that's the first question they will ask you is, okay, which pharmacy you want me to call the medications. So that's very important. Good idea to carry the list of your medication. Some people are very good, they will remember each medication and the doses they are taking. If you are not good in remembering things, carry the list with you. If something emergency comes, you have to see someone, or even sometimes 911 is called. If you have a list of the medication ready, it will help those individuals to find out, okay, what you are taking. Sometimes people may carry a medical alert bracelet, especially if you're traveling alone and suddenly your blood sugar drops low. Then the person sitting next to you or who is attending to you may not know that you have diabetes or not. But if they see a medical alert bracelet, they will immediately realize, and sometimes low blood sugar people can pass out. So if somebody sees a medical alert bracelet, they can easily take action and then bring blood sugars up. Getting a travel letter from your physician also is helpful when you're going through the security. That will highlight that you have diabetes and you are carrying these insulin syringes, needles, other sensors with you. So that is always helpful. And very, very important thing is always pack more than what you need. Suddenly there is a flight delay, something else comes up, you get sick, then it's important to have extra medication. So that's very, very important. Always pack more than if you're going out for 1 week, maybe pack for 2 weeks. So in that way, you don't run out of the medication. All right, next slide. Now, if you are wearing your sensor, glucose sensor, or you have the insulin pump, then you can, while going through the security, you can let them know, so that in that way they can sometimes, if you don't want to go through the main machine, like where they screen you, they can just with a handheld screener, I mean, they can patch you and just make sure that your equipment doesn't get damaged. But in general, going through the security, it doesn't damage. The sensors, if placed in a deposit where the luggage which you plan to deposit, those type of x-rays can sometimes damage the sensors. So it's important to carry the extra glucose sensors in your carry-on bag and not in the bag which you're going to deposit. So that's important. The insulin pens, if you're carrying an ice pack, take a separate bag, you can put a ice pack over there that will keep the pens. If you're traveling for a longer period of time, then good idea to keep the insulin pen, and once you reach there, then you can put it back in the refrigerator. If you're driving, inside of the car sometimes gets very hot. So especially if you stop in between and then go out for walking or something, by the time you come back, the car will get very hot. So don't leave insulin or other equipment like that. Always keep it with the cooler, especially when you're driving. You also will like to pack healthy foods and then plenty of water to drink. Don't, as I mentioned, don't leave these insulin pumps, insulins like outside in hot weather. So because that can also damage the insulin and other equipment. And when traveling, always carry extra snacks with you, glucose tablets with you, and especially if you're carrying glucagon injections, they're very helpful, because suddenly if you don't eat, you have taken your medication, blood sugar goes very low, you will require your glucagon injection. So these are important things to remember, to pack them along with your medication supply. Keeping your medication in original packaging, if possible, that's good. But again, if there are too many bottles, then you can take it out. There is only one diabetic medication called Rybelsus. That should not be taken out of the original bottle, because it's can easily, if you leave it outside or in a different container, the moisture can build up in that and it can sort of make the medication ineffective. So always important to keep it in original packaging for this medication. Now, for going through the security, the people with diabetes, they are exempt from the TSA rule of not carrying more than 3 ounces of liquid. So if you have that travel letter, they will let you go through that. You can say, okay, I'm carrying this, my orange juice with me, where I tend to have low blood sugar, so I need to keep it with me. They will allow you, but you need to have that letter with you. There's an optional TSA disability notification card that you can print and carry with you. That will also help you to quickly move through the lines. And then always carry fast acting carbs like glucose tablets, hard candies, whatever you like and normally use it, keep it with you. That's important while in the flight, or later on if you need it, you can quickly eat those things and avoid low blood sugars. And then always eat healthy food during your travel. So here is a list of medication, and Caroline is going to talk more about the dietary choices that you should have while traveling. So because you don't want your blood sugars go too high or too low during travel, that also messes up your whole day. So if it's running too high, what you will do is frequently you have to go to the bathroom, and that also is not good while on the flight. So again, you want to have a reasonable control, but always eating healthy food is important. Next one. So during travel, please make sure keep well hydrated. That's very important. There are certain medications like Jardians, Farxiga, metformin. With those medications, it's important to drink plenty amount of water. You don't want risk getting dehydrated, and that can affect the kidney function test, and it can affect with these medication can cause volume depletion. People can feel dizzy, blood pressure can run low. So again, important to make sure you drink plenty amount of water. Carry water with you, or if you don't, then in between, no harm in asking the flight attendants to give you water. Avoid too much of caffeinated drinks, which can cause more dehydration. So drink more water. During flight travel, or if you're driving, don't keep sitting for too long, risk for blood clots. So every hour or so, just get up, walk around, and then you can get back to your seat. Then also plan according how long is the flight, and when you will be able to eat or not, because if you take your usual medication, especially if somebody's on long-acting insulin, and other drugs like called sulfonylurea, these are glipizide, glimepiride type of drugs, or glyburide. These are long-acting medications which can cause low blood sugars. So for example, if you take these medications in the morning, and then while doing the flight, there is nothing to eat, you miss your meals, you were running late, you did not pick up your lunch, and nowadays in the flight also, they don't give you proper full meal tray. There are some snacks that you can buy. So, but again, if you miss your meal, then if you have already taken the full dose of insulin and other medication, then risk for low blood sugar. So again, be careful. If you're not sure, maybe take half the dose. Keep a watch on your blood sugars. I mean, you don't want either too low or too high. So average 120s, 150s range, that's a good number to shoot for. Then as I explained earlier, keep your glucose tablets, snacks handy. So immediately if you feel some low blood sugar reaction while sitting in a plane or driving, immediately take some glucose tablets. Obviously, if you're driving, then immediately stop driving. If you are the driver, make sure you check your blood sugars, that it's not running low, because driving with the low blood sugars can really jeopardize your health and someone else on the road. People can be in accidents. So important to make sure your blood sugar is staying above 100. Then keep your glucose meter, the test strips, lancets close by, handy, because you want to, while traveling, you want to make sure that if you have in somewhere else, it's not handy, then you will be where to find the lancet. So where is this? Where is that? I need check my blood sugars. So always keep it handy, which is easy for you to check if the blood sugar is on the low side. Next slide. Sometimes if you are hiking, going to the higher altitude, that can lead to incorrect blood sugar readings. So just be careful. For every 1,000 feet of height, there may be 1 to 2% lower blood sugar readings because of the lower oxygen pressure. So just keep that in mind. And also when flying, just avoid injecting air into the bottle sometimes, because the pressure that can cause more pressure buildup. So just have to be careful about these things. But most of the time, the pressure within the air flight is reasonable and you should not have a problem. Now, again, with the blood sugars, life is not perfect. You cannot, when you're eating from outside, it's difficult to gauge how much carbs you are eating. So again, if you try to indulge in more different type of foods from different restaurants, you may not know exactly how much carbs are going in, and blood sugars can run high. That will make you pee more and sometimes risk for dehydration. So always carry extra medication, especially insulin. Then you may take more insulin than your usual days to bring the blood sugars down. But again, at the same time, don't overreact and take too much insulin because low blood sugars are not equally good. Sometimes it takes hours to rebound from a low blood sugar. You don't feel good. Your body feels more tired. You're not back to your usual. So if you have a hectic schedule, low blood sugar reaction can really mess up your whole plan. So make extra efforts to avoid low blood sugars, keeping your blood sugars in the around 150s range. That's a reasonable number. And again, when you are more active, then your insulin requirement also goes down. So typically in day-to-day activity, if you don't do any exercise, and suddenly now you're on a trip and now you have to walk extra mile, that exercise is going to really drop your blood sugars, especially if you're on insulin or other sulfonylurea. So just be very cautious on those days when you're more physically active than your usual days. Take less medication, especially insulin and the sulfonylurea. Then eating outside, as explained earlier, especially like, for example, here I've given an example of if you're on a cruise, there's always a buffet. So our temptation is, okay, keep on eating, eat more. So again, that can also mess up your blood sugars, can run high. Then while sleeping, you have been frequently getting up to pee because that will make you urinate more often, risk for dehydration. So in that way, it's important to not to overdo on your eating, still eat healthy foods, maybe order small healthy meals rather than eating from buffet, or if you're eating from buffet, make the right choice. But in general, avoid high carb meals. Then again, physical activity wise, sometimes we get carried over, like we have companies and they are walking at their own pace. They are doing their exercise, everything. If you are not used to do that type of activity, please stop. Don't try to compete with others. Know your body. If the body is telling you something wrong, stop. Don't go to that same level of activity as someone else. So again, as explained earlier, in unusual physical activity can drop your blood sugar. So keep a close watch on your readings. Then while outside, please be careful. Don't be in the sun for too long and get a sunburn. Then if diabetes under poor control, sometimes with these severe skin burns, then risk for infection. If you're at a beach, don't go bare feet. Wear some slippers. And at the end of the day, very important to inspect your feet for any cuts, any injuries, because you want to take care of them immediately rather than let it run like that and then have infection that can really spoil your vacation. So be careful, carry some cleaning wipes with you. It's a good idea to keep your hands clean before checking blood sugars or injecting the insulin. So that because sometimes you don't find anything to clean your hands. So it's important. Sometimes the food is sticking on your hands, especially juices or something, and that can falsely give you high readings. So good idea to at least clean your hands before checking the blood sugars. Then always carry a small disposable box for the sharps, for the pen needles. That's then you don't want to throw it here and there. So just good idea to keep it with you. You can dispose of your syringes and the pen needles. And if somebody's on insulin pump, very, very important to carry insulin syringes with you, because if there's sudden pump failure, then you have to inject the insulin. You already will have a insulin vial with you. So you can then use the syringe to inject insulin before each meal. And then in the middle of the night to at least you can carry on before the pump company sends you, like they will, typically they are good. They will send you a new pump within within 24 to 48 hours. But during that time, you should have insulin syringes to be able to give yourself insulin. And the insulin, as I explained earlier, carry in with the ice pack. And then once you reach your hotel or somewhere else where you will be residing, you can keep the other insulin which are not in use, any other things in the fridge, and the insulin pens or the vials which you're using, that's good even if you leave at the room temperature. Next one. So I think this one I explained earlier about the eating the carbs, and Caroline is going to go more in detail about the diet. But again, please don't overdo on the carbs. That's very, very important. Eating outside pizza from one shop to the other shop, the amount of carbs in the food will be totally different. So again, watch your portion size, take the right dose of insulin, and avoid extreme high or low blood sugars. If you are not sure that about the food, then take less insulin. That's important. Then the weather difference can also have an impact. Your physical activity, if it's a cold weather, typically we tend to be less sedentary, then you may need less medication. High temperature, if you're sweating a lot, that may cause more risk for dehydration and the effect of the kidneys. So you may need to drink more on those days when you are in extreme high temperature. So be careful about these things. Patient with type 1 diabetes should carry ketone strips with them too. If blood sugars are running high, if there's symptoms of confusion, dry mouth, fruity odor, having nausea, vomiting, abdominal pain, these may be the signs of diabetic ketoacidosis. So this can become a life-threatening situation. So you should not ignore these symptoms. Based on your blood sugars, take extra amount of insulin, and then you should head to the ER if you have these type of symptoms along with high ketones in the urine. And this needs to be treated promptly. Now, with all these trips, again, there's something may go wrong. You may learn from every trip. Okay, maybe I should have done like this. Maybe I should have carried this snack, this. So always go back and say, okay, from this trip, what did I learn? How I can make my next trip better, avoiding the mistakes which I did during the previous one. So again, if you have some questions about the insulin pump, the insulin doses, or some other medication, okay, should I have cut down? Should I have increased the dose? Once you come back, you can go to your physician and ask them these questions, so you are better prepared for your next trip. So again, diabetes should not stop you from enjoying your life. You should be prepared with all your medications and go full speed with enjoying your life. But at the same time, keep a close watch on your blood sugars during your travel. That is very, very critical. So I will stop over here, and I think I'll let Caroline talk about the diet, which is equally important because you want to enjoy the diet from different places wherever you are going. And one last thing, actually, I did not mention over here, drinking. Remember not to drink heavily. When you are taking too many drinks, that can shut down the liver from making extra glucose. So for example, if you are drinking too much, not eating properly, then if the blood sugar goes low, typically a person without drinking, the liver will make extra glucose and will bring the blood sugar up. But if somebody has been drinking too much, then the liver may not be able to compensate by making extra glucose, and they will be more prone for severe low blood sugar reaction. So please watch the amount of drinking you are doing. Just 1 to 2 drinks is good. But again, at the same time, don't drink on an empty stomach. Have snacks with it. Eat the right amount of carbs. So that's also equally important.
And I just want to clarify, when we say drinking in this scenario, we're talking drinking the alcoholic
Alcohol,
drinks.
yeah, not like
And-
not water
and not the
drinking.
water.
Right? Not water is
Yeah.
as much as you want. I'm talking about the drinking is alcohol, like too much wine,
And I
other
thought so, but just in
hard
case,
drinks.
right, in case somebody only hears part of this, they kind of like pick up at a certain point, we want to make sure we're
Right, right.
clarifying the alcohol. And I think one thing that we can say we learned from that, right, Dr. Hundal, is all the great information that you're providing to our patients. So it's, the beginning of May, right? The unofficial kickoff of summer is coming at the end of this month with Memorial Day. So I think one of the things here, and it just kind of dawned on me now, but something we can always do for our patients is maybe creating a checklist, right, of these types of things. So we mentioned all of this, but maybe having a checklist. So as they're packing or as they're preparing for their trip, we kind of have it in a nice little checklist for them. So maybe, Caroline, that's something that we can look at doing and putting out on our website so that we have a traveling checklist preparation just to help everyone.
Definitely.
So I will go ahead and reshare my screen here. Are you able to see it, Caroline?
Yes. Yeah.
All right. So we will move more into traveling and eating out with diabetes.
Awesome. So like Dr. Hundal mentioned, eating is one of the most fun parts of vacation, right? You get to try all these different foods, especially if you're going somewhere you've never been before, different cultures. It can also bring some stress too, because you might, from patients I've talked to, they're afraid of what they should eat, what they shouldn't eat. So today we're going to kind of go through ways we can eat out, be mindful while we do so, but also still enjoy the fact that we're vacationing, that we're enjoying other parts of the country or other places that we've never been before. So there are ways we can manage our blood sugar. Our goal is just to prepare ourselves with the knowledge that supports our blood sugar and gives us sustainable energy, right? If you've got a long day ahead, obviously going with really simple carbohydrates like a bagel in the morning, right? That's not going to sustain you for a long time, and your blood sugar is most likely going to hop up pretty high. So we could work with certain types of carbs, pair them with certain things like proteins and fiber, and that's going to help keep that sustainable energy and keep you going for a longer time than something as a simple carb would just kind of fizzle out after a couple hours. So some eating out tips just to get us started. We want to get creative. So a lot of restaurants these days, you can look ahead, you can look online. They have their menus online, which is fantastic for kind of preparing yourself before you go in. I know when I'm hungry, I can't really think straight, so I'm going to pick whatever sounds good. But if I go into a restaurant with some ideas that I know what's on the menu, right, I have less of a chance of kind of picking something out of just straight feelings of hunger and more of, oh, that sounds good. That's going to support my blood sugar a little better. This might sustain me a little longer. So giving yourself that time to kind of look ahead, see if they have a menu online. A lot of places actually have the healthy choice options, which is great because they have, I think they're marked with like usually like a little symbol that says these are normally like a lower calorie or a lower carbohydrate or higher vegetables. They're also usually pretty better in portion size too. So those are a really great place to start looking when you are going somewhere new or going to a restaurant. A lot of the times, I know Donna and I were talking about this the other day. They bring bread to the table, and what do? Obviously, I'm a bread lover. So what do you do with your meal if you decide to have bread as an appetizer, right? Making note of this is a carbohydrate source. So if I'm going to have something right after this, I need to make sure, 1, we've got protein density. 2, we've got some fiber in there. And 3, maybe we go light on the carbs at dinner because I just really wanted to enjoy some bread on my vacation. So kind of giving yourself that balance of just being mindful, what am I going to have at this meal at the appetizer? Am I going to have dessert, if any? Because if you do end up going for the dessert route, you'll want to make sure that you balance those carbohydrates at the meal to make sure that you don't overdo it. Somewhere that you could find hidden areas of carbohydrates might be the dressings and sugary beverages. So keeping in mind, if you get a large salad, right, the dressing is fine. And if you're not having other carb sources, it might not be an issue. But if you're adding its own sauces and different condiments, right, that's a place where sugar can come from too. So just being aware of that when you are choosing to order something that might have sauces, maybe ask for it on the side. You could dip it, you could drizzle it rather than it all being mixed and you're not really sure how much you are using. Portion sizing is also, I find it to be the most difficult one on vacation because you see everybody else with big portions, right? And you get excited and things taste really good. Just being aware when you have the option to either split it in half or you have the option to, if you're thinking fast food you just have the super size option, right? Thinking of that, maybe adjusting into a smaller portion or having maybe only half now and save the rest for later if possible. We want to refrain from overly restricting though. So we don't have to, make ourselves get grilled chicken and a salad on vacation and just be upset with that. We still want to satisfy ourselves because overly restricting can lead to kind of binging out or overeating later on if we don't satisfy kind of that need to want to eat a specific food. So our goal is to maybe balance the type of food that you're really craving or you're really wanting with a little extra vegetable, maybe a little extra fiber thrown in there. Maybe we just portion size out the carb instead. So we don't have to go all the way to the other side of the pendulum and restrict completely, but we also don't want to go to the other end and overeat. So there's a really nice little balance in between that takes practice. Switching up your sides is one of my favorite things to try, especially on vacation, just because sometimes the meal itself is pretty heavy in carbs. So say you wanted something fried or you wanted something that's pretty rich in carbohydrate, right? Having a side of fries or a side of onion rings or something like that is going to up your carb intake for the day. So maybe seeing if you can switch out a side, maybe add a side salad instead, something with a little extra fiber, a little extra vegetable there. That can do a lot in maintaining your carb levels for the day too. So these are just some general eating tips. If you go to any kind of restaurant, just keeping a mindful eye of. What was really on my mind when I was thinking of traveling is we were just stuck in a car for 8 hours on our recent vacation and we were stuck with fast food options because we didn't have anything else. So I wanted to discuss ways that we can include these foods because these foods are often like a big no that we talk about of just making sure we don't eat these places often because a lot of the time the carb amount is pretty high and then usually the protein can be pretty low and there's a lot of other kind of components that might not make this the healthiest choice. So our option is to try to find a way that we can kind of avoid demonizing this food, but instead focusing on what can we have here that's going to support our blood sugar best if this is an option for us. If this is the only thing that's available on the road, how do we approach these places and do it in a way that's blood sugar friendly? So we're going to go over these most popular. Of course, there are way more than these, but we're going to go through some of these restaurants and fast food places and see what are our best options to look for on their current menus. So next slide, please. So we have Taco Bell and Chipotle. So we can see by both that they have some bowl options. They see some vegetables here, which is great. I think these two places have some really awesome healthier choice areas because you can see Taco Bell has that fresco menu, which is nice because they're going to label everything. The beautiful thing about food service now is they usually have at most chain restaurants a label that tells you the nutrition information so that you can make an informed decision kind of what carbs are going to support my blood sugar best right now. Do I have fiber? Do I have protein? That type of thing. So one of the best things at Taco Bell that you can maybe look at are some crunchy style beef tacos. They're around 32 grams for 2 tacos. So keeping that in mind, that's a good portion of carb right there. So making sure that if you're going to do a side, you take that into account, right? We make sure maybe there's a side salad option, or maybe we're going to have a side of beans to add extra fiber, right? They have about 13 grams of protein. So it's not a large amount of protein, but it's still a good source if you're getting 2 small tacos. The Power Bowl is really nice right here. We can see it is pretty bigger. It's bigger than the other options on here. So it is on higher carb level. So it's about 65 grams of carb, but this is a great splitting meal. So if you're splitting it with someone and you just want to have an extra side salad and split this with someone, that would be a really great option to split. As for Chipotle has a different couple options. They have a really nice salad bowl where you can add your protein on the top. And a lot of these places now have online menus where you can go online and look at the nutrition information. You can even customize some things, especially with Chipotle. I know you can swipe left and you can get like half portions of things. So say the bowl, sometimes the bowls, if you get the rice bowl, it's pretty dense in rice. So you're going to get a lot of carbohydrates from that source. So you can do half a serving of rice and then load up on extra beans or extra chicken or extra vegetables and get extra fiber in there too. So you do have a lot of customizable options here. It's just kind of knowing what you, one, are really craving, right? If I'm really craving, I want some rice, but I don't want a whole bowl of rice, right? You want to take that into account if you're on the road, you're not moving, you're not being very active while you're on the road. So taking that into account as well. So our next place is Burger King and McDonald's. So these are a little harder to find the best option to manage your blood sugar because you don't have a lot of options for added vegetable, a lot of option for added fiber. So here we kind of pick and choose of what is going to give us the lowest density of carbohydrate and the best protein source when we need it. The Whopper Junior tends to be the lowest carbohydrate amount. That's about 27 grams of carb. Now you can always decrease that amount by solely removing the bun, right? If you wanted to do, say, maybe a side salad, you could do the burger on top of the side salad, and that would dramatically decrease the carbohydrate amount. It does have about 13 grams of protein, so you are getting a good source of protein. But here at these two places, I really think the side, like switching up the side, is going to give you the greatest benefit, especially since if you want a burger, right? If you get fries, you're obviously probably going to go above that carb level where your blood sugar is going to increase. Now, I'm not sure if Burger King still has this, but they used to have a Morningstar veggie burger. It was pretty good. So that's a really great plant-based source. It has a lower saturated fat rate. It's got pretty similar carbohydrates to the Whopper Junior, but again, you would remove the bun if you wanted to decrease the carb amount. And it's got about 21 grams of protein, so more than the burger. So you kind of can pick and choose kind of plant-based versus meat-based. Now for McDonald's, the ones on the menu that I found were best suited for blood sugar management was the fish fillet, which had about 38 grams of carb. So still in the higher range. You could then get a side salad or take off the bun. Maybe you just want the tartar sauce on top of the little fillet and then put that with a salad. You've got a better option there instead of relying solely on the bun to be that carb source. It's got about 17 grams of protein, so a mild amount. Or you could do the classic cheeseburger, which is about 33 grams of carb. It's pretty low in fiber, so you got 2 grams and then 15 grams of protein. So then again, you still want to try to maybe switch up the side. Maybe you take off the bun and switch for apple slices or something which has more fiber in it than the white bun alone would. So those are some ways you can make it more diabetes friendly. Wendy's and Chick-fil-A. So this one was a little different because Chick-fil-A, I think, won with the amount of options that were blood sugar friendly in a dietitian opinion. But Wendy's did have a grilled chicken wrap, which had the lowest saturated fat. It had 26 grams of carb, so not too bad for a meal, and then 2 grams of fiber. So it's not the best we could do, but it's also being mindful of the amount of protein to carb ratio, which is great because it's got, I believe it's got about 26 depending on the size you get, grams of protein too. And then the junior cheeseburger as well has about 26 grams of carbs, 16 grams of protein. So again, it kind of is, what are you going to get your carb source from? Obviously with the wrap, you can't like undo it and eat the, I mean, you could eat the insides, but you might as well get a salad if you're going that route. Most of the salads at Wendy's or McDonald's or Burger King, they had the dressing component was the main source of the carbohydrate, or like those additives, right? Like the tortilla chips, the fruits, and those types of things that you add on top. So those are always an option that you can customize too. As you can see on Chick-fil-A, their salad, their Cobb salad was actually a really great option. But just being mindful that the additives that you put on top, like the dressing, even if you have corn on top, you've got tortilla chips, right? That adds up over time. So I believe that the salad was about 29 grams of protein, and it had about like 20-ish grams of carbohydrate. So just taking that into mind, you can decrease that if you don't decide to add toppings to it. The grilled chicken cool wrap, I think, is a great option because you've got a really great source of fiber on the outer shell of that, and you've got some really lean protein on the side. That's the grilled chicken, which is great for kind of keeping you full. They do offer sauces for this, so just being careful of, if you want a little bit of sauce, you drizzle it on yourself and dip it rather than just kind of smothering it on. With grilled chicken tender, or you could do the grilled chicken tenders, which they have the little grilled nuggets, or you could do the fried chicken. But no, with the fried chicken, you're getting more carbohydrate with that. So the 4-count chicken strip, I believe, is about 39 grams of protein. It is 22 grams of carbohydrate. So it's a good source of protein, and then you still have the carbohydrate there. But if you pair it with the kale crunchy salad right here on the left, it's about 8-ish grams of carbohydrate. You get about 30 grams total for your meal. So that would be a really sustainable meal for you to have, because you'd have a protein and you'd have some fiber, you'd have some vegetable. So that would keep you fuller for a longer time, and not really exceeding a high amount of carbohydrate at one meal. So our next places to review are Starbucks and Panera. These by far were some of my favorite ones to look at, because there's a lot of different customizable options, especially with Panera. For Starbucks, you've got kind of this panini that has a little bit more carbohydrate than the others. It's got about 42 grams. So taking that into account, if you're going to do a lot of walking that day, like say you're doing a stop on your road trip and you're walking around, this might be a good one to have, because you are going to be moving a little bit more. Noting that you want to make sure you have a good source of protein in there too. So other options here, like the quinoa salad and the Power Bowl, have those protein options and sustainability as well. As for Panera, I like the You Pick Two. The You Pick Two is great. You've got kind of half a sandwich, half a salad. You can really control the carbohydrate amount. So say you want to satisfy yourself with a sandwich, but you also don't want to go above your carb limit, you kind of have that salad as a backup plan too. And then our final place to review, which I think wins, I'll put my top favorite of like winning the lowest carbohydrate meal, would be Jersey Mike's. This Subway option, to have the really great menu of the Get Fit, Get Going menu, where they have whole grain options. They've got smaller sizes, good protein sources. But Jersey Mike's actually has everything in a bowl, right? This looks like a good sustainable meal to keep you full, because you still got all this protein in there. I think they win by having 8 grams of total carb in this bowl. They could do a cheesesteak in a bowl, like a chicken cheesesteak, or you could do a sub in a bowl. So I'd say Jersey Mike's wins for the lowest carb density. If you're looking to kind of limit your carbs overall, that's the place I would probably recommend going. But all these places that I'm saying could be modifiable, customizable to your preference on where you want your blood sugar to be, how tightly you're looking to control those blood sugars, and what your carb limit is for the day. And on our next slide, I just have snacks on the go. Obviously, being prepared can help us control our blood sugar. So if we're able to pack some snacks for a travel day ahead of time, we're going to spend less money overall, and we're probably going to keep tighter control of our blood sugar too. So these are just some protein carb pairings, right? Because protein source is great for maintaining that blood sugar, a little bit of carb for the energy. There's a good healthy balance. So these are just some examples of that. And then just a quick summary on overall traveling and eating out. Eating out happens. There's a way to increase the nutrient value in everything you eat just by adding and making small switches to support our blood sugar better. So practice makes perfect. We don't always make the best blood sugar friendly choices, but we use that as a learning experience. It's all about practice and balance. And so one bad blood sugar doesn't mean it's a failure. It just means it's a learning experience and tool to take you on the next trip. So that is our overview for today of traveling with diabetes and how to eat when eating out.
All right, I'm going to stop there. Thank you both. I think it was great information. And I know that Caroline focused a lot right on more of the fast food places, but I think as she was talking through that, it was giving you information though that you could carry over to any type of restaurant, because again, it's going to depend where you are. Are you local? Are you, in an area that doesn't have very many restaurants? Are you in a whole new country? So just taking into account the guidance that she gave you can be taken from place to place, right? Keeping those things in mind. And again, I think having a checklist, we did not build one here for you, but that's something we certainly will do in the future and put on our website. But I think even listening to this, hopefully you can jot down some of those things. And if you already do a checklist when you're preparing and packing, is keeping those things in mind. I did just want to ask you one question, Dr. Hundal. Going back to very early in your presentation, you were talking about medications and making sure we pack our medications. And I think one thing that I've heard, patients sometimes say is, well, what if I'm going to be gone for 3 weeks and my medications are due to run out halfway through? they can always call and get you to either put in a refill early, or sometimes the insurance company can do an override to even give them a certain amount of medication, correct? Knowing that they will be traveling.
Yeah, there are a lot of people who travel overseas, goes out of the country, and they always request a larger amount of medication. So we just, when we send a prescription to the pharmacy, we usually write down that,
The purpose.
yeah, so
Right.
that is what most of the time insurances don't create any problems.
Right. I just wanted to put that out there so that people don't worry, what do I do if it's going to run out? So again, reaching out to your provider office and making sure that you're addressing that in
Right,
advance.
right.
As Dr. Hundal
Yep.
said, don't wait till 2 hours before you're going to leave, right? You need to do it. So you should be looking at that a week or so in advance and preparing and having time to call and get through to your physician office and have them call it in, and the pharmacy to fill it. So again, thank you both for your time today, and hopefully this has been information that will benefit many patients as we prepare for the summer and usually an increase in traveling. So thanks again, everyone, for joining us, and we will, Kamal will be back and joining you for the regular community updates in the weeks to come. Thank you.
All right, thank you.